The World Health Organization says new air quality recommendations could prevent millions of deaths each year. The WHO updated its maximum levels for pollutants for the first time in more than 15 years. Colorado is way too familiar with some of these. Tiny PM 2.5 particles from faraway wildfires made our air worse all summer. The WHO now says health problems from those pollutants can start at lower levels than expected. It recommends cutting the concentration of those particles in half. More than 90% of the world's population lives in places that blew through that standard. Joining us now, Dr. David Rojas. He's an assistant professor at CSU who advised the WHO on these changes. So, Dr. Rojas, thank you for being here. I mean, these guidelines haven't so much changed since 2005. What have we learned during that time that's driving these new recommendations finally?
So these have been 16 years of evolution of science, and we have more than 500 studies that tell us that even in low levels of air pollution, we still see a lot of health impacts: asthma cases, cancer cases, cardiovascular disease, and premature mortality. So these new guidelines actually provide us a recommendation of the levels that we need to arrive to actually protect health.
So, I mean, Colorado's air quality was so bad this summer, of course, the smoke coming in from out of state, but we had days where this was the worst air quality in the world. What do these new guidelines mean for us in that capacity?
So they're telling us that we need to take care of those days, but also need to take care of days like today, that looks like it's a very good day for quality, but actually we're still living in levels that are not healthy. So these guidelines tell us that yesterday, what was air quality, a good air quality, is not exactly what now we say that what good air quality should be. So these guidelines provide us an opportunity and a tool to actually arrive to gain more health.
And Dr. Rojas, we know your research has been so extensive up to now. What is next for you when it comes to air quality?
So we actually are mapping the whole state of Colorado to actually measure all the air pollutants and provide that information to the community. We are working with the Colorado Department of Public Health and Environment to actually provide that to take better decisions. So we need more knowledge, we need more data, but we need that the people also is informed about their air quality in their communities.
All right, changes for the first time in 15 years. Dr. Rojas, thank you for the work that you're doing.